For the last 2 decades, Florida has battled a brutal and fatal opioid crisis. But in the last 2 years, deaths due to drugs, opioids, and fentanyl have finally started to decline. There are many factors for the decrease in addictions and deaths, including doctors utilizing procedures that require fewer painkillers. Dr. Christopher Sforzo is a board-certified orthopedic surgeon with Sforzo, Dillingham, and Stewart, and he is here to talk about these different procedures in today's Transformation Thursday. Great to see you again, Doctor.
Great to see you, too.
I'm so glad that the statistics are trending in the right direction, and appreciative that it does have a lot to do with advances in offices like yours.
Absolutely.
So explain to us how past techniques unknowingly created a massive pill problem.
So in the past, one of the things we used to talk about to patients is that pain was something we should never have, and at any time. And that was usually masked by opioids or painkillers, specifically things like oxycodone, hydrocodone. And so we would perpetually, as physicians, give patients these drugs, not only preoperatively, but for an extended period post-operatively. And that was truly a mistake on our whole society's part. And so in the last several years, we've tried to diminish the amount of narcotics that patients have gotten. We've also done a lot of good studies to show what procedures are the most painful and where we can interject different treatments either before surgery or after surgery, or non-operative treatments to help diminish the need for narcotics. And that's really where the breakthrough has come.
And, honestly, a lot of things came out of physician control, too, in fairness to physicians. Then the bad guys got a hold of them, and then they, we all know how the downfall came.
Things got out of control.
Things got out of control. So now we've corrected to the other side, which is wonderful.
Right.
Talk about some of the new technology and procedures that are keeping people off pain drugs, even preoperatively.
So preoperatively right now, it's been a really great technology, a procedure that is called cryoneurolysis, kind of a big term, cryoneurolysis. So what does that mean?
Right, what does it mean?
Cryoneurolysis essentially is freezing of nerves. And so it's a temporary turning off of nerve fibers, specifically pain fibers, to areas that we are going to eventually operate on. And the 2 areas that we're using it right now for are the knee, so preoperatively for, say, before knee replacements. And then I'm a shoulder surgeon, specifically for patients preoperatively for rotator cuff repairs and also for shoulder replacements. And so what typically happens is that this device is done in the office, this procedure. No anesthesia is needed except for just a little bit of local, we call it lidocaine or
a numbing
medicine,
yep.
right? And then under ultrasound guidance, the nerves are then frozen in different areas to help then diminish pain, not only immediately. Most patients see almost immediate relief of pain that they're having preoperatively.
Wonderful.
And that can last between 2 weeks to almost 90 days, which is really great.
So it can get you to your surgery.
Exactly. So typically we deploy that procedure about 2 weeks prior to surgery to give us a little bit of a buffer beforehand, and then it typically will last up to 90 days even after surgery, which is great. So the benefit of that is less pain, not only intraoperatively, but obviously post-operatively, which is wonderful.
Okay, and then let's talk about lasers, which I know are good post-operatively and sometimes even a replacement for surgery. What a bonus.
Exactly. And so what we're doing right now is harnessing the power of light. So a laser has the ability to get into the soft tissues and also into joints and tendons to do something called photobiomodulation, so PBT. So that's a very long word that basically means that the laser transmission gets down to the cellular level and does actually changes at the cell level. Changes that include increased blood flow, decreased pain receptors, to decrease the amount of inflammatory cytokines that are actually delivered. So all of that will diminish pain, diminish swelling, also helps healing. So we're employing it after surgery to help with skin healing and soft tissue healing. We're using it in acute injuries like shoulder or ankle or knee sprains where you get really swollen, tough to get your motion back. We can deploy that immediately to do that. And so the laser that we're using right now is a company in town called Ortho, and they are new to this area. There's only one other one in the whole southeast region. We're the only one in the state that has one, which is really great.
That is great.
And it's a special proprietary laser that uses 2 areas of wavelengths at 808 and 905. So they both are pulsed in a special area. One is actually continuous and one is pulsed. but they do all the factors that we need, which is diminish inflammation, diminish pain, and accentuate healing.
And the takeaway here is that you're using the latest technology, all with the umbrella effect of keeping people off of these opioids, which is so incredibly important.
Absolutely. Both are FDA approved, and the cryoneurolysis procedure is covered by Medicare, which is great.
Wonderful.
The treatments by the ortho laser are also FDA approved, and we're using them both preoperatively, postoperatively, but also, like you said, non-operatively as well, to treat all kinds of tendonitis, arthritis, all inflammation.
All right, well, thank you for the explainer and certainly for bringing this technology right here to the Suncoast. To get more information about technology helping treat your pain without pills, you can go to sforzodillingham.com.